everyone, my name is Shaiza Tomar and today I'm going to talk about some diseases and their causes also. So let's start. So basically this assignment was given by respected Akshay sir. So I want to ask that don't you guys think that whenever we fall ill, there's a question arises in our mind that why do we fall ill? What is the reason behind this? So let's investigate and see why do we fall ill. Basically, human health is affected by various factors, causes or sources, but in this presentation, I just talk about diseases caused by microorganisms such as viruses, bacteria, fungi, protozoas and worms. So firstly, I am going to talk about some diseases which are caused by different types of viruses. Let's see. So the very first one is common cold and it is caused by rhinoviruses. So common colds are the main reason that children miss school and adults miss work. Each year in India, there are millions of cases of the common cold. Adults have an average of 2 to 3 colds per year and children have even more. Most people get colds in the winter and spring, but it is possible to get a cold any time of the year. Symptoms usually include sore throat, runny nose, coughing, sneezing, headaches and body aches. Most people recover within about 7 to 10 days. However, people with weak immune system, asthma or respiratory conditions may develop serious illness like pneumonia. The second one is influenza. It is a common viral infection that can be deadly, especially in high-risk groups. The flu attacks the lungs, nose and throat. Young children, older adults, pregnant women and people with chronic diseases or weak immune system are at high risk. Basically, it spreads easily and partly preventable by vaccine. Usually, it is self-treatable and diagnosable also. The third one is dengue fever and it is caused by dengue virus or we can say that DENV. Basically, DENV is a single positive stranded RNA. It is a mosquito-borne viral disease occurring in tropical and subtropical areas. Those who become infected with the virus a second time are at significantly greater risk of developing severe disease. And yes, sometimes it is very critical and need emergency care. And it is an acute disease which resolves within days to weeks. The fourth one is swine flu. It is caused by swine influenza virus or swine origin influenza virus. It is a human respiratory infection caused by an influenza strain that started in pigs. Swine flu was first recognized in the 1919 pandemic and still circulates as a seasonal flu virus. Swine flu is caused by the H1N1 virus strain which started in pigs. And it is very rare, fewer than 1 million cases per year in India and it is preventable by vaccine and also an acute disease. The fifth one is hepatitis B. It is a serious liver infection caused by the hepatitis B virus that is easily preventable by a vaccine. This disease is most commonly spread by exposure to infected bodily fluids. This disease is also preventable by vaccine. The sixth one is AIDS and its full form is acquired immunodeficiency syndrome and it is caused by HIV virus. HIV causes AIDS and interfere with the body's ability to fight infections and infections. Basically, we can say that it attacks on our immune system. The virus can be transmitted through contact with infected blood, semen or vaginal fluids. The seventh one is chickenpox and it is caused by Varicella zoster virus. It is a highly contagious viral infection which causes an itchy, blister-like rash on the skin. Chickenpox is highly contagious to those who have not had the disease or been vaccinated against it. It is usually self-treatable but it spreads easily and it is an acute disease. Now I am going to talk about some diseases which are caused by various bacteria. So let's start. The very first one is typhoid fever and it is caused by Salmonella typhi. Basically, it is an infection that spreads through contaminated food and water. Vaccines are recommended in areas where typhoid fever is very very common. And yes, it is also very rare. And it is also a acute disease. And yes, it is partly preventable by vaccine. The second one is cholera, and it is caused by Vibrio cholerae. It is a bacterial disease causing severe diarrhea and dehydration, usually spread in mutton. Cholera is fatal if not treated in a right way. It is an acute disease, but sometimes it is very critical and needs emergency care. The third one is tuberculosis, and it is caused by Mycobacterium tuberculosis. It is a potentially serious infectious bacterial disease that mainly affects the lungs. The bacteria that cause TB are spread when an infected person coughs or sneezes. Most people infected with the bacteria that cause tuberculosis don't have symptoms. When symptoms do occur, they usually include a cough, weight loss, night sweats, and fever. The fourth one is anthrax, and it is caused by Bacillus anthracis. It is rare but serious bacterial illness. Anthrax is caused by a spore-forming bacterium. It mainly affects animals. Humans can become infected through contact with an infected animal or by inhaling spores. Symptoms depend on the route of infection. They can range from a skin ulcer with a dark scab to difficulty in breathing. Antibiotic treatment cures most infections. Inhaled anthrax is harder to treat and can be fatal for us. The fifth one is acne. It is caused by P. acnes. P. acnes is the name of the bacteria that live on the skin and contributes to the infection of pimples. Research suggests that the severity and frequency of acne depend on the strain of bacteria. Not all acne bacteria trigger pimples. And yes, it is very common among teenagers. Now I am going to talk about some diseases which are caused by fungi. So let's start. The very first one is athlete's foot, and it is caused by dermatophytes. It is a fungal infection that usually begins between the toes. Athlete's foot commonly occurs in people whose feet have become very sweaty while confined with tight skin shoes and wet socks. And yes, it is a communicable disease. Symptoms include a scaly rash that usually causes itching, stinging, and burning. People with athlete's foot can have moist, raw skin between their toes. Treatment involves topical antifungal medication. The second one is ringworm. It is also caused by dermatophytes. It is a highly contagious fungal infection of the skin or scalp. Ringworm is spread by skin-to-skin contact or by touching an infected animal or object. Yes, it is a communicable disease and spreads easily. Sometimes it is self-treatable also. Ringworm is typically scaly and may be red and itchy. Ringworm of the scalp is common in children where it may cause bald patches. The treatment for ringworm is antifungal medication. Now I am going to talk about some diseases which are caused by Protozoa. Let's start. The very first one is malaria, and it is caused by Plasmodium parasite. And it is also called Plasmodium infection. It is a disease caused by Plasmodium parasite transmitted by the bite of infected mosquitoes. The severity of malaria varies based on the species of Plasmodium. Symptoms are chills, fever, and sweating, usually occurring a few weeks after being bitten. People traveling to areas where malaria is common typically take protective drugs before, during, and after their trip. Treatment includes anti-malarial drugs. The second one is sleeping sickness, and it is caused by Trypanosoma, a disease caused by infection with the parasite Trypanosoma. African Trypanosoma is transmitted to humans by tsetse fly bites. The tsetse flies are originally found only in rural Africa. Early symptoms include fever, headaches, joint pains, and itching. Later stages may include behavioral change, confusion, and poor coordination. Treatment involves drugs to kill the parasites. So now I am going to talk about some diseases which are caused by worms. Let's start. The very first one is intestinal worm infections, and it is caused by Ascaris worm. Some types of helminths and protozoa are classified as intestinal parasites that cause infection, those that resides in the intestines. These infections can damage or sicken the host, humans or other animals. If the intestinal parasite infection is caused by helminths, the infection is called helminthiasis. The second one is elephantiasis, which is caused by filarial nematodes. It is also called filariasis. It is a tropical parasitic disease that affects the lymph nodes and lymph vessels. Lymphatic filariasis is spread by infected mosquitoes. Their bites deposit a parasite that travels through the lymph system. It is extremely rare disease. And yes, it is a chronic disease and can last for years or be lifelong. Most cases are symptomless, rarely long-term damage to the lymph system causing swelling in the legs, arms. It also increases the risk of frequent bacterial infections that harden and thicken the skin. Treatment consists of antibiotics and antiparasitic. And yes, it may cause death if not treated in time. So that is it. Thank you so much for giving your precious time to see my presentation.